everyone, this is Ria and welcome to Narikaa Talk Show. Let's learn together and grow. And today it is a moment of extreme pleasure to welcome our very acclaimed doctor, Dr. Pooja Lodha, who is present here with us and she will be answering some of our questions regarding today's topic, which is what to expect from NT scan. So, doctor, before jumping to the questions directly, please tell our viewers something about yourself.
Thank you, Ria. So I'm Dr. Pooja Lodha. I'm from Pune, and I'm basically a gynecologist, but I've super specialized in a term known as fetal medicine. So fetal medicine means caring for the unborn baby. So actually, what made me think of this branch is that as gynecs, we always think about the mother, her blood pressure, her weight gain, and what is happening with her, her delivery plans, and 9 months of what happens to her. But we really don't think specially about the baby in the womb. And this branch of fetal medicine is actually about caring for the unborn baby and looking at the high risk pregnancies during my training of obstetrics and gynecology is what actually prompted me to become a fetal medicine specialist.
All right, doctor. And doctor, what moment would you say was the moment when you decided to become a doctor?
So I've always grown up in a family of doctors, my parents being doctors, my brother being a doctor. And I watched how my mother takes care of babies after they are born. She's a pediatrician. And I thought, why start caring for the baby after the baby is born? Let's start before the baby is born. And that prompted me to become a fetal medicine specialist.
Well, thank you, doctor. So, as the topic itself says, NT scan, which is nuclear translucency scan. So, doctor, what exactly is NT scan, NT test?
So the NT scan is actually a sonography. It is an ultrasound that is done between 11 and 14 weeks of pregnancy. And this is now a standard of care in our country. So we do not call it an optional test anymore, but we recommend to all our pregnant women to go ahead with this ultrasound, which is known as the Nuchal Translucency ultrasound. This ultrasound basically is done for Down syndrome, chromosomal abnormalities, mental abnormalities, and a lot more things which we'll hear later in this talk. But nuchal translucency, the term per se, means the fluid behind the neck. So nuchal means neck and translucency means the fluid behind the neck. Now this fluid behind the neck or nuchal translucency or NT as it is called is important because as the NT in a baby increases, it increases the baby's risks for having problems like Down syndrome, chromosomal abnormalities, and other heart and bone problems.
Doctor, what does NT test for?
So, like we heard, NT tests for Down syndrome and chromosomal abnormalities. But it is very interesting to know it is not just the mental or the chromosomal abnormalities that the NT tests for. It also tests, it's kind of a predictor or a surrogate marker for what is going to happen to the baby later in pregnancy or in life. So, some of these babies with a high NT could have Down syndrome, could have mental abnormalities, or could even be mentally normal, but still have structural problems. For example, a heart problem or growth problems like the long bones may not grow properly. There may be a problem in the diaphragm, in the brain, and that could be seen later in pregnancy. So, in short, we should not ignore this nuchal translucency scan, and it should be done in a very proper way.
All right, doctor. And doctor, when exactly is this NT scan done?
So this NT scan is done between 11 and 14 weeks of pregnancy. So we have practically now shifted the care for the baby from 30 weeks to 20 weeks to now 11 weeks. So as early as 11 to 12 weeks, we want to do an ultrasound for the baby and look for problems. One of them is nuchal translucency. What more we look at on this scan is the nasal bone, the nose of the baby, if it has developed or not. We look at the growth of the baby, we look at the heartbeat and the heart rate. We can also look at the anatomy or the structures of the baby. Now, this is something new and very interesting, because so far the structural check of the baby was done at 18 to 20 weeks, which is the fifth month. But with better machines and better training, we can now look at almost 60 to 70% of the structures of the baby on this so-called nuchal translucency scan. So we can look at the head, brain, the hands, legs, the umbilical cord that attaches the mother and the baby, the placenta, a lot of the heart. So a lot of these structures can actually be seen as early as 11 to 12 weeks. So typically when the baby is between 45 millimeters and 84 millimeters long, we can do this nuchal translucency scan. But now, because this nuchal translucency scan looks at so many things and not just the nuchal translucency, we no more call it the NT scan. We call it the first trimester scan.
All right, doctor. And doctor, who performs this NT scan?
So, a person who's performing the nuchal translucency scan should essentially be specially trained for doing it. So, there are various kinds of doctors who take special interest in caring for the unborn. We could be an obstetrician trained in fetal medicine, we could be a radiologist trained in fetal medicine. But what is important is that a person who's accredited to do an NT scan and is a trained fetal medicine specialist should be performing this scan. That's because even small millimeter differences in measurements can take a lot of, can translate into a lot of decision making for the couple, and therefore all this needs to be done with a lot of precision.
So, doctor, earlier you spoke about first trimester screening test. So, doctor, can you please elaborate on this first trimester screening test?
So the first trimester screening test basically consists of two parts. One is the ultrasound and one is a blood test. The ultrasound is this scan that we were talking about, which looks at the fluid behind the neck, which is the nuchal translucency, the nasal bone, which is the nose of the baby, various blood flows in the heart and the tummy of the baby. It also looks at the structures of the baby. Now, these markers are then combined with a blood test, which is known as a double marker, which is done after this ultrasound. Now, this double marker also checks for chromosomal abnormalities, and that is particularly Down syndrome, Edwards syndrome, and Patau syndrome. Now, why these three syndromes are chosen? Because these are the commonest chromosomal abnormalities that we can look for in the baby. And when this ultrasound done properly is combined with this blood test known as double marker, we can pick up a lot of these so-called mentally or chromosomally abnormal babies, which could be really difficult to handle post birth. So it's important to diagnose them at this period itself.
Okay, thank you, doctor. And doctor, who should get this NT screening test?
That's a very good question. Initially, it was thought that it's only the elderly who should have this screening test. But now we have spread enough awareness over the last decade or so that it's not only the elderly, but anybody who's expecting a baby, any pregnant lady, every pregnant lady should undergo a first trimester ultrasound or a nuchal translucency sonography along with a double marker. And that is because even if your age is 20 or 24 years and you're not really in the advanced maternal age or the elderly group, you still have a risk for having a baby with chromosomal problems or Down syndrome. So it's important that we spread across a message which says that every mother who is pregnant should undergo a good nuchal translucency scan coupled with a double marker blood test.
All right, doctor. So moving on to our next question, which is how is NT screening done? I mean, what is the process behind the NT screening test?
So this ultrasound is typically done at 11 to 12 weeks, as we said. Now, while doing an ultrasound, you will be asked to probably go for a walk in between, or drink water, or empty your bladder, or eat something and come back. And that is because our patients are babies in your womb, and we can't talk to them, right? We can't make them turn around. That show us the neck, show us the hands, which is why we have to wait for the baby to turn around and pose for us. Now, if your baby is not in a position where we can take a good nuchal translucency measurement, or where we can look at various structures in the baby, you may be told to wait for a while. So do not worry. These scans can take time, but it's important that the scan is done with a lot of precision. So with an ultrasound probe and a jelly that would be put on your tummy, the baby would be visible on the screen. You would be shown the baby, the heartbeat, the length, the fluid behind the neck, the nose. And if your fetal medicine specialist or the person who's scanning you has a 3D, that could also be seen. But I'd like to take this opportunity to tell everybody that 3D and 4D scans are purely for entertainment right now. Okay, so there are couples who come up saying that we want a 3D scan. Well, it's very good if your baby poses and we give you a very fancy picture, but this is just for entertainment. For us doctors to know that your baby is physically and structurally and mentally normal, we need a basic, thorough, good ultrasound. Okay, so please make sure that your nuchal translucency scan is done with a lot of precision. And if you have to wait, do not worry about it. The results are definitely worth it.
All right, it's time for a little break now. We will all see you in next few minutes. Welcome back to Narikaa Talk Show again. So next question for our viewers is, Doctor, when you get the result of NT test, so how are the results of the NT test is calculated?
So the nuchal translucency sonography, or the 12-week ultrasound that we are doing, the report is usually released immediately after the ultrasound. Now, this ultrasound or the sonography report has to be submitted to the genetic lab where you are giving your double marker. So, like we spoke, the first trimester screening has two components. One is a sonography or an NT scan, another is a double marker. Now, this ultrasound report needs to be submitted to the genetic lab where the lady is giving the blood for double marker. The lab will then combine the ultrasound markers, which is the NT and the nasal bone, along with the double marker, and release the final risk. Now, the final risk will be released by the lab. It could take 3 to 4 days because that is the processing time of the double marker. Okay, so the ultrasound reports we've got almost immediately or after a few hours from the clinic, but the double marker usually takes 3 to 4 days, and therefore the final result that you get will be after 3 to 4 days of your nuchal translucency scan. Of course, we usually tell the patient during scan how the baby is looking, but the risks that you were mentioning about is calculated by the lab. Now, there are two kinds of risks that the lab will release. One is a low risk and one is a high risk. In case you get a low risk result, it usually means that the baby is looking fine, okay? Which means that the ultrasound is normal and the double marker is fine. So that will put you into a low risk, which means you can now relax about this aspect of your baby. Now, if there is a high risk, do not worry. It doesn't necessarily mean that your baby has a problem, but yes, it definitely means that you need further testing. Okay, so you need to go back to your gynecologist, you need to go back to your fetal medicine specialist, show them your reports and let them interpret it for you. Once it is interpreted, it is low risk, you will be called back after a few weeks for your routine checkups. But if it is high risk, you will be told about further options to make sure that your baby, whether your baby is really abnormal and that's why the risks are high, or is your baby normal and in spite of that your risks are high. But remember, there is no category known as no risk. It's always either low risk or high risk. Because the needle test or the amnio synthesis or the chromosomal abnormalities, which is the needle test or the chorionic villus sampling, which are the 100% tests, which then put you into no risk because they will confirm that the baby does not have Down syndrome. These tests are not performed for everyone. They are reserved for women who get high risk on the first trimester screening or a problem on the ultrasound.
All right, doctor. And doctor, what happens if an NT scan indicates a problem?
So if the NT scan indicates a problem, it could either be that the nuchal translucency is increased, so which means that the fluid behind the neck is increased. Now, this fluid could mean that the baby is chromosomally abnormal, so which means the genes of the baby are abnormal, the chromosomes are abnormal. It could mean that the baby's structures are going to be abnormal in future, and we need to be sure that this baby is normal before we continue this pregnancy. And therefore, like I told you before, that we need to check this with a confirmatory test. Now, there are two kinds of confirmatory tests. One is a chorionic villus sampling or a CVS, which is done between 11 and 14 weeks, where we take out a tissue from the placenta of the baby and send it for genetic testing. Or if the patient has been, giving some time to themselves to think about the situation, and they come back at 15-16 weeks, then the test that we do for confirmation is known as the amniocentesis or the needle test, where we put in the needle around the baby, we take out some fluid for testing and send it for genetic testing. So these are the confirmatory tests which will tell us if the baby has Down syndrome or any other chromosomal abnormality. Once this test has come normal, we need to ensure that the serial ultrasounds are done to make sure that the structures are also normal along with the chromosomes of the baby. So this is how we follow up an abnormal nuchal translucency scan. In case there is a very big problem where we know that the baby is not going to do good, in that situation, we give them a diagnosis using a CVS or an amniocentesis. And if there is a problem on CVS and amniocentesis, then the couple usually decides to discontinue the pregnancy because there is no treatment available for chromosomal abnormalities.
Okay, doctor. So, next question is: are there any risks to the pregnant lady or the baby while performing the NT screening test?
So while performing the NT screening test, there are no risks to the mother or the baby because this is an ultrasound which is safe for the baby and the mother, and the double marker is a blood test which is also safe for both. The risks, very slight risks involved, are in the confirmatory test that I was talking about, which is CVS or amniocentesis. But these tests are only reserved for women who have a problem on ultrasound or the double marker. And even those risks for miscarriage are very less than 1 in 1,000. So the routine NT screening, which is the ultrasound and the double marker, do not have any risks or hazards to the baby or the mother at all.
Doctor, and doctor, what is NT standard measurement?
So there is no one number which is normal. The NT will change according to the length of the baby. But practically any value more than 3 millimeters is considered high. Otherwise, as the baby's length increases, or the CRL as we call it, that's how the NT measurements increases. So there is a graph that your doctor will use to counsel you regarding your NT measurements.
All right, doctor. So, doctor, next question is, does an abnormal NT scan means woman has a Down syndrome?
So, NT scan is a screening, and screening can never confirm a problem. It can only tell you whether this is high risk or low risk. So, if we find that the NT is high on the ultrasound or the double marker is high risk, all the NT screening is high risk, it only means that this baby has a chance of having Down syndrome. It does not confirm that the baby has Down syndrome. And the only confirmatory tests are either doing a CVS between 11 and 14 weeks or doing an amniocentesis between 16 and 20 weeks. So the only way to confirm Down syndrome is to do a chorionic villus sampling or an amniocentesis. Never should a decision be made to terminate or discontinue a pregnancy on the basis of an abnormal NT scan or a high nuchal translucency.
Doctor. So, doctor, what happens if a woman has high chances of having Down syndrome?
If a woman has high chances of having Down syndrome, as shown by the nuchal translucency test or the double marker or both combined, she should undergo one of the two invasive testing, either chorionic villus sampling or amniocentesis.
And doctor, what can be done if a woman misses doing the first trimester NT scan?
A woman misses doing a first trimester NT scan and presents late in pregnancy, or is lost to follow up and is unable to do her NT scan and double marker, then she should be offered an ultrasound at 16 weeks for the aneuploidy markers or the markers of Down syndrome, and a quadruple marker should be done instead of a double marker. So after 16 weeks, we can do a quadruple marker for her and do an aneuploidy sonography to tell her the risks for Down syndrome. But mind well, it is not as accurate as the first trimester screening. And therefore, we should encourage our patients to not miss the first trimester screening.
So, all right, doctor, thanks a lot for sharing your informative views on it. And I hope this session was really helpful and beneficial to all the lovely viewers out there. So, before leaving, doctor, is there anything else that you would like to share with our viewers?
So, yes, I would definitely want to tell them that do the best that you can for your baby to find out that the baby is structurally and mentally healthy. Do not miss important tests because these are all timed and you cannot do it at any time in pregnancy. And this whole journey of your pregnancy, for your pregnancy and your unborn baby, we all are with you to work with you. Thank you so much.
Thank you, doctor. Well, doctor, that was really a great response,
Thank
and
you,
it
Narikaa.
means
Thank you, Rita.
really a lot to us to be with you in a Narikaa talk show. And thanks a lot for your precious time, doctor. Thank you.
Thank you. On Narika, thank you very much. And thank you, Ria.
Okay, so we will meet you in another exciting topic. So till then, to all the lovely viewers, stay tuned, stay happy, and stay healthy.